Hello, my name is Representative Pam Powers Hanley, and I represent LD9 in Tucson in the Arizona House. Well, it's late in the day on Thursday, February 6th, because we had a marathon Health and Human Services Committee meeting. So the most controversial bill and the one that took the longest on our agenda was HB 2388. This is a Kathy Herod bill from the Center for Arizona Policy, and basically it has two parts. One part's okay, one part's not okay. One part of it is to give money to the information and referral line, which had funding cut many years ago, and they are not going 24/7 right now. So I have no problem with that part of the bill. The other part of the bill that I do have a problem with is that they also give money to a crisis pregnancy centers. And so what we found out in committee today was that these crisis pregnancy centers are unregulated, unlicensed, and not inspected by the Arizona Department of Health Services. This was shocking to me. We also learned that they may or may not have a medical director, even though they are giving medical information and medical advice, and they are providing medical services like ultrasound and vaginal exams. Why do they not have a medical director? Why is the Arizona Department of Health Services not involved in this process? Didn't we learn a lesson from the Hacienda Healthcare scandal from 2019? You'll remember that Hacienda Healthcare was somehow not licensed by HHS. It was operating and taking care of patients with no licensure. And what happened? A patient was raped and impregnated and while she was in a vegetative state. You know, we need oversight. If there's going to be medical procedures given at these crisis pregnancy centers, even if they are for free, Representative Bardo kept saying, well, these are free services. Well, just because they're free doesn't mean that we want them being done by anybody. We need trained professionals. We need oversight. We need the health department to get involved in this. The other thing that bothers me about these, I asked the Representative Udall, who is the sponsor, I said, does it bother you that government-funded information services would be offering biased and incomplete medical information to callers, since they would not be able to mention abortion, refer to an abortion clinic, or refer to a clinic that does lots of other things, including abortion? And she said no, it didn't bother her that they were offering incomplete medical information to women in crisis. That's just wrong. These pregnancy centers need to be offering full services. Anything that is a legal drug and a legal service in the state of Arizona, if we have a publicly funded information line, they should be giving the public all the information, not just the information that certain people want them to learn. So this is a bad bill. Not to rattle on, we also heard that they're targeting these women with GIS and big data. I mean, there's so many things wrong with this.